Welcome to the ReAD Help Video 1.2. This video focuses on describing an option using the MIOP format. My name is Terry Haines. The ReAD helps you to compare different options. Defining and describing exactly what these options are is extremely important and can be the most difficult part of using the ReAD. To assist you in this, we have developed the MIOP approach. MIOP stands for Magnitude of Resources, Intervention, Outcome, and Population. The magnitude of resources is often determined by the budgetary change or amounts allocated to particular services or activities. When describing this amount of resource, you need to specify the time horizon associated with the option. You may also need to consider whether there are fixed costs involved, for example, needed to purchase one-off pieces of equipment, and variable costs, for example, staff time, that will change with the amount of service provided or the number of patients seen. The intervention. This is the activity that you are planning to commence or increase or to cease or reduce. The temptation is to think of this as a person, for example, a physiotherapist, instead of what the person actually does, for example, conduct balance assessment and retraining. When using the MIOP, it's important to focus on the activity the person performs, because it's that action which is what you are actually funding. If multiple activities are performed, then try to focus on the key activity, or you may need to complete multiple ReAD reports for the different activities. This will assist you when later using the ReAD to describe the effectiveness and cost effectiveness of this option that you are considering. The outcome. Consider the key outcome that this option impacts upon. Some options may impact on multiple outcomes. Think about whether there is a downstream outcome that can be the broader focus. To move downstream, think about an outcome and then consider the question, why is this outcome important? The outcomes might be important for the individual patient, the community more broadly, or for the health service. Population. Who are the individuals that this option has been or will be provided to? Here is an example that I will apply using the MIOP format. I want to know if I should keep funding a weekend allied health service on the acute medical wards at my hospital. The total amount of budget that is allocated to this service is approximately $1 million per year. The intervention itself is made up of many different disciplines. For example, physiotherapists, occupational therapists, social workers, dietitians, speech pathologists. It's important to try and refine this a bit further. So, I'm going to break the intervention down. Instead of focusing on all the allied health services, I'm now just going to focus on the physiotherapists working in the weekend allied health area on the acute medical wards. The magnitude of resource involved now has changed. Instead of $1 million per year, our estimate is now $600,000 per year. It's also important, as I've previously mentioned, that we don't focus on the person or the profession, rather the activity that they perform. So in our example, we've gone to our staff members and found out what the most common activity is that they perform, the one that is done most frequently. In this case, it is mobility assessments and gait aid prescriptions performed by the physiotherapists. The outcome, or the intended outcome, of this intervention is to improve gait independence of the patients that we are seeing. Why is this outcome important? Well, if we improve gait independence, this might have an effect on the rate of falls while older adults are in hospital. It might enhance patient mobility and reduce functional decline, which is often seen in hospital patients who stay in hospital for longer lengths of time. And this in turn might also facilitate discharge planning. All of these intermediate effects might have the overall effect from the health service perspective of reducing lengths of stay in hospital. It may also improve the quality of life of people on the wards. So, our MIOP example has now changed. Our magnitude of resource is $600,000 per year. The intervention is mobility assessment and gait aid prescription performed by physiotherapists working on the acute weekend allied health service. The outcome is a reduced length of stay in hospital, reduced falls in hospital, improved patient mobility and activity levels in hospital. And our population is patients in the acute medical wards present on weekends. However, we might need to refine this further because not all of these patients are seen by the physiotherapists for this service all the time. Instead, it might just be those who are rated as Category A on our risk of long-term length of stay categorization that we use at our hospital.